Hi, everybody. Welcome to my presentation. I'm focusing on the topic of how does the gut biome, and in turn, that means how does food affect mood, basically. Food, mood, nutrition, I'm very interested in that. So I did my project on the Food and Mood Center, which is in Australia, and it's part of Deakin University. The Food and Mood Center conducts high-quality research that helps us learn about diet and nutrition and how we can prevent and treat and reduce the risk of mental disorders using diet and nutrition. So they have a broad target population, which is anyone really affected by mental health or mood disorders. They have a strong focus on studying depression and anxiety, but they also study schizophrenia and cognitive decline. They're also targeting their information towards people interested in optimizing mental health through diet and nutrition, and health professionals and communities seeking evidence-based nutritional guidance for mental health. The ways that they're meeting the needs of the population is they're generating research and evidence into how nutritional choices affect the gut biome, and that in turn affects the gut-brain axis and mood, and how those all can lead to depression and ways to heal depression with using nutrition and gut microbiome. Don't have the word. Gut microbiome changes. So they're investigating how nutrition influences the brain and the mood and mental health. And they're testing dietary interventions to see how that affects mental health outcomes. Interventions like the Mediterranean diet, the paleo diet. They're also researching and how or if ultra-processed food consumption is associated with depression risk. And they have a really great blog. You can find out everything, how food affects sleep, what to eat if you're exercising a lot, food to stop cognitive decline in old age. Anything you're interested in to do with food is on their blog. I've just searched Food and Mood Center, Australia. They're also then translating that research into things that are understandable for the public and disseminating education courses, many of which are free. So free online courses that anyone can sign up to. They have accredited trainings for health professionals, such as psychiatrists, dietitians, and doctors, so that we as counselors, for example, can bring the research findings into clinical practice and help our clients. And then they also translate their research and educate the community they have a Friends of the Food and Mood Center section where they ask for public feedback. They ask you to join panels, and anyone can participate in their trials, their research trials. They're also meeting the needs of the population by influencing policy and clinical guidelines. So in Australia, for sure, diet is now being considered along with exercise and sleep, and smoking in mood disorder management. And the center participates in international task forces to develop lifestyle medicine guidelines for psychiatry. So the program was founded in 2017 by Professor Felice Jaca. They say that this is the world's first research center dedicated to nutritional psychiatry. They've expanded now to more than 50 researchers from diverse disciplines, and such as microbiology and psychiatry and public health. And their education courses have enrolled 70,000 participants from 170 countries. They've also attracted a lot of philanthropic support, and in 2025 secured 8 million Australian dollars in grants. And their research is informing clinical practice and guidelines in Australia and in other parts of the world. So stakeholder voices are incorporated through the Friends program, where the public is invited to give feedback, also get involved in community panels to discuss the way the research is done and basically give feedback on the course and direction of the work. Participants in the free courses also give feedback, which provides insights into the public's interests and needs and misconceptions. And the center collaborates with practitioners to get insights on what practitioners need and the barriers to uptake they might have, and how to package the research into usable clinical formats. And all the stakeholders give feedback on the design and the direction of the research studies. The current strengths of the organization, the experts are multidisciplinary, the leaders are from multidisciplinary backgrounds. As I said before, microbiology, psychiatry, public health, nutrition studies, which gives a holistic approach to their research. Professor Felice Jacka is globally recognized in nutritional psychiatry, which gives them credibility. They have strong funding success. They've received substantial competitive grants and philanthropic support. Their online courses have reached tens of thousands of people, which increases awareness and public engagement. And they are having an influence on clinical guidelines and policy initiatives. Their mission emphasizes not only discovering insights, but also translating them for clinicians, public health, and communities so that they're accessible in layman's language. And then their research uses innovative approaches. Not many facilities are researching the microbiome or dietary proteins like A1 and A2 milk. So they're pushing boundaries in that way. And their work on ultra-processed diet and mental health links is at the forefront of nutritional psychiatry. So current challenges, it's always a challenge to translate research findings into clinical practice implications, suggestions, because many mental health clinicians lack training in nutrition, which limits their uptake of the recommendations. Funding, sustainability, and scaling can be a challenge because they're relying on philanthropic funds and competitive grants. So there's always some financial security when you're relying on that. They face some public skepticism or scientific resistance. What they're doing to combat that is making sure their studies are rigorous and replicable to overcome any of skepticism in the public. And then the gut-brain, diet-brain mechanisms, the biological pathways like the inflammation pathway and nutrient-brain signaling are really complex. So it's hard to establish causality, what causes what. It's also making sure that findings and interventions are accessible to diverse, underserved populations can be a challenge as well. Getting that information out to rural, low socioeconomic groups can be a challenge. And then accurately measuring diet adherence and long-term behavior change in study groups can be challenging, as well as integrating nutritional advice into mental health services. How the challenges are being addressed. They call it a translation gap, translating the research into publicly understandable language. They do that with their free courses that are accessible to everyone. And in that way, they're hoping to build awareness and offer baseline knowledge to the public and professionals. They also have their accredited trainings to teach practitioners how to apply nutritional psychiatry in clinical environments. They secured a very large grant in 2025, which has strengthened their financial base for this year for sure. As I said, they emphasize really rigorous design in their studies and investigation, replication, and to build credibility in the scientific and the clinical community. They're always expanding their multidisciplinary collaboration by bringing together experts from multiple fields like nutrition, psychiatry, microbiome science, and they partner with external institutions all over the world. They use small-scale pilot data to test feasibility, and then optimize their protocols, and then they apply for major grants to do a large-scale study. They engage the public via Friends of the Food and Mood Center function, where you can register and have your voice heard in the way they plan their research and run their studies. And you receive a letter with their blog posts and their findings. It's very easy. Go to the Food and Mood Center website, look for the Friends portion, and they ask you some questions, whether you want to be involved in having your voice heard, and then they keep you in the loop. You can even participate in co-designing their programs and helping give your 2 cents on feasibility studies and clinical trials. And then they contribute to international task forces to disseminate the information out into the world and to work for policy level change. So there we are. Thank you so much for your time. And there's the link to the Food and Mood Center. And I hope you get to explore it if you're interested. Thanks so much.